Hola! Welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn lessons from the hospital. Today's case is a personal one, where I started a surgery as a doctor and finished it as a patient. I particularly remember this day because I looked forward to it. I was an intern doctor, and it was my first time doing a cesarean section, what we know as CS. So it was my first time doing a CS, and in med school we usually observe, but you are never really into the procedure or assisting. And in this case, I was assisting a procedure, which is the CS. It was a sunny morning, looking forward to the day. I remember I was so jolly. I arrived in the theater particularly early because I love surgeries. I actually aspire to be a surgeon. And we began the procedure. We introduced ourselves to the patients. We introduced ourselves among the healthcare workers. I was the assistant surgeon. The surgeon asked me if I've ever done a CS. I told her no. I remember she's this particular good guy. And I told her no, it was my first time. So she was ready to teach me and take me along the procedure. So the surgeon doing the procedure is usually on the right, and the one assisting is on the left. I'm the one assisting, so I am on the left. And we start the procedure. The patient is numbed. We begin, and in cesarean sections, you have to go through 5 layers to get to the uterus and extract the baby. So we are going through the layers, and it's becoming, when you read about it and when you're taught about it in school, it is so much different from when you get to witness it. And so now I'm getting to witness it, and the lead surgeon is asking me about the layers. Yes, I can remember the layers and everything, but I'm also mesmerized. I felt like I'm in the presence of this godly procedure of giving life. The baby is extracted, and in between the baby being extracted, I start sweating. I was sweating bullets. I start seeing darkness coming in and out. It's like I'm zooming in into darkness and out, and I'm wondering what is going on. The next thing I know, I was outside, surrounded by nurses asking me, "Doc, are you okay?" They're trying to ungown my theater gowns, and I'm wondering what is going on. They're trying to give me fresh air. I don't know what went on. So apparently, I passed out mid-procedure. Like, it looks like it was a lot seeing it than reading it. And also the lead surgeon told me she understood, because in cesarean section there's a lot of fluids, because it's not only blood, there's also amniotic fluid, there's also extraction of the placenta, which as opposed to other procedures, it's just blood. And these days there are so many innovations in medicine, like laparoscopy, where the blood is usually very minimal. The procedures is very take 2. So in this generation, there's a lot of medical innovations, such like the laparoscopic surgeries, where there's minimal blood, minimal invasive procedures as compared to the cesarean section. Let me help you visualize what usually goes on in a cesarean section. As I've mentioned before, you go through 5 layers. It's easier to digest the perspective when it is being spoken to you and when you're reading it in books, as opposed to when you see it physically. Because remember, this is a pregnant woman, so the abdomen is distended. So we have to cut through the skin. We also have to go through the muscles of the stomach, the muscles of the belly, the rectors, what we usually call the abs. There's also another one called transversus abdominis, which is an extensive muscle running just from the diaphragm going down. And I am seeing us going through these layers, and these are muscles. They are tough, so you have to use a little force. Okay, let me not say a little, because you have to use force. These are muscles. And by the time we haven't even extracted the baby, but I could feel it get to me. I could feel it take it at all on me. But I was holding strong. I was like, no, I want to be a surgeon. This is what I want to do. And by the time we get to the baby, we extract the baby, the amniotic fluid usually bursts out. It spills all over. I tried to comprehend that. I don't even know how I digested that. So also we have to extract the placenta. Remember, because this is a cesarean section, the mom is not going through labor. Normally, during labor, the uterus is able to expel the placenta, but here it's cesarean, so you have to do the work of extracting the placenta with your hands. I'm seeing this. Remember, it's my first time. And also now, we have to cut the umbilical cord. You have to revive the baby and help them cry. This is where you see in movies the baby stand upside down and maybe hit on the bum or something. And as the assistant surgeon, remember, I'm the one holding the baby. I'm helping clamp the cord. We're now going to repair and suture the uterus. So how you cut in 5 layers, you also repair in 5 layers. You don't repair one big suture. You repair first the layer of the uterus, repair the other uterus, the other layers as you come up until the skin. But as you heard, I did not get to the skin. Midway the procedure of repairing, I think it was too much for me. I passed out and was revived after. Maybe I don't know, maybe I want to now deal with children only. And then I remember with children, I can also be called in theater, and then I'm like, no, maybe I'll just stick to psychiatry. Anyway, my parents encouraged me, and I told myself maybe I'll get over it. And by the time I was doing the second procedure, it was so much better. Actually, the nurses were in theater surrounding me, waiting for anything to happen, because they had heard of the story of the intern doctor, Dr. Josie, who had passed out. Anyway, as we did the second procedure, I proceeded on well. It did not take a toll on me. I think I needed that first shock so that I can digest how things are done. I was also told some other intern doctors also passed out, which was a relief. At least I was not the only one. And from there on, cesareans have been a favorite to do. And they no longer shock me. I understand what happens now. Hats off to all women, because bringing life into this earth is godly. I'll just call it godly. That is how I went home in the morning of my first day doing a cesarean section as a patient. But flash forward, I am now very good in cesarean sections. I actually love doing cesarean sections. They're actually my favorite surgeries to do. What do you think about it? How would you have handled it? Till next time, ciao.